The completion of the Goulburn Hospital and Health Service redevelopment is truly a momentous occasion in the history of healthcare in this community.
The hospital is the heart of a community, and for a community like Goulburn, it's the start of life, it's the end of life, it's a lot of significant events in between that. It certainly does feel like we're delivering a new community for Goulburn. The most rewarding part about this project has been the team environment and the collaboration between stakeholders across all aspects of the redevelopment. It started with the clinical services building, which was completed in late 2021, and that's then continued into the final works package, which has been delivered over the course of the last 18 months.
You've got architects and we've got builders. We've got project managers, we've got consultants and subcontractors and numerous people with various skills all coming together to build this fabulous hospital for Goulburn. We selected a random selection of patients which we worked with from very early on, and they became our patient and consumer group. That group became invaluable in the little things that were important to them that they really wanted us to make sure were included in this new hospital. Things like a day bed, so that if they needed to sleep over at night, that there was somewhere to lay down. Make sure there's somewhere to park my wheelchair. So that if I'm in a waiting room, that there's somewhere for me to sit and I don't have to go outside. That the chairs will take the right weight in the corridor. If I need to stop, the chair will actually take my weight. We have an ICU that can care for patients closer to home. In the past, if you needed ventilation and things like that, within 24 hours we would have had to send you on to somewhere else. Without a really highly functioning ICU, you can't do all the other things that you need in surgery and other parts of the hospital without that in place. So I think that's been probably one of the big achievements from my perspective.
The main improvements that we've seen in the new hospital compared to where we came from are definitely the space and the access to equipment and resources. Where we came from, the spaces were much smaller and we had difficulty moving the patients around their rooms and the corridors.
The patients almost every day tell me how nice this hospital is and how grateful they are to be here, and it gives me a sense of pride as well to be able to look after them in this new space, new building.
This redevelopment has provided our healthcare team here in Goulburn with an amazing facility that will allow them to continue to provide the highest quality of care for the community we are privileged to serve now and into the future.
Looking back over the last 10 years, the biggest achievements on this project have been the collaboration with staff and community to design and deliver such a significant facility. Then during delivery, the challenges with working on a construction site on a hospital during the COVID pandemic. Getting materials into the country was a significant challenge. There was also getting workers to the construction site during periods of lockdown. It was a significant effort and a testament to the entire team.
We involved the Aboriginal community as well in the development of the hospital, and particularly in the art. We wanted to make sure that it was an environment that they felt comfortable in. When we first started with Arts and Heritage Working Group, our little motto was, remember the past as we move to the future. We ended up with a fabulous group of volunteers working on all the historical items from Goulburn and from Bourke Street. And all of those were then used to put into the lovely display that you now see in Springfield Place. That space is beautiful.
It's the most significant upgrade the Goulburn Hospital has seen in its remarkable 130-year history. As you look around the facility today, you will see a completely transformed hospital with bright, well-lit rooms, state-of-the-art operating theatres and brand new equipment and technology.
As someone that works here, we have access to the things that we need to do our job more effectively now, and that helps us with providing better patient care. When I come to work now, I feel that the space that we're in is more vibrant and welcoming, more inviting and more friendly and more social, and also more supportive for the patients too. And we get a lot of that feedback from patients that it's just a nicer place to be.
Every day the nurses show up here with a smile on their face and a good attitude, which is nice to see. It has brought us closer together as a team. When I started my nursing degree, I definitely wasn't thinking that I'd be a part of anything like this. I certainly feel very privileged to be a part of that.
It's very satisfying to get to the end of a project like this and to be able to say with some pride that we've delivered this through some very hard times over a long period of time as well, and end up with a successful result that we've achieved.
It's been a privilege to be a part of this planning process and see it evolve into what it's become.
What we achieved with our $165 million is actually quite remarkable. The end result is a hospital that does our community proud, and we should be proud of that.